Erectile disorder, or ED, is a sexual dysfunction in which there is repeated failure to attain or maintain erections during at least 75% of instances of sexual activity.
ED is extremely prevalent among penis owners, with approximately 40 to 50% older than 60 reporting significant issues with erections. By age 70, rates increase to approximately 70%. Both psychological and physiological issues can contribute to erectile disorder. However, 80% of cases have physiological causes. Psychogenic ED is comorbid with anxiety and depressive disorders. These cases are typically treated with cognitive behavioral therapy and oral medications such as Viagra or Cialis. The majority of those with ED have physiological comorbidity with cardiovascular disease, diabetes, obesity, prostate cancer, hypertension, or other diseases interfering with vascular, neurological, or endocrine functions. It is also comorbid with medication, alcohol, and substance use. Endothelial dysfunction, issues with blood flow and what contributes to heart disease, seems to be a main cause of ED. Erectile dysfunction is referred to as the canary in the coal mine because it almost always comes shortly, around 2 or 3 years, before cardiac symptoms. Evidence linking ED and heart disease is so strong that it is now recommended that patients with ED symptoms who are free from cardiac symptoms should be considered cardiac patients until proven otherwise.
There is good news though. Medications are very effective for ED, about 60%. And while medications are still the primary treatment, research shows that several lifestyle interventions can not only reverse erectile dysfunction, but also reverse several of the physiological conditions that are comorbid with ED, including diabetes and heart disease.
Lifestyle treatments for ED include stopping tobacco and drug use, limiting alcohol, increasing exercise, managing weight, and improving diet. Nutrition appears to have a protective and healing effect. Research shows that a higher intake of plant-based foods, which are high in anti-inflammatory compounds, has significantly lower rates of ED. In the documentary Game Changers, Dr. Aaron Spitz demonstrated just how impactful a single plant-based meal can be. He conducted an experiment on athletes assessing erection size, frequency, and duration of erections during sleep after a meat-based meal and a plant-based meal. After the plant-based meal, the number of erections increased by 3 to 5 times.
I think this is going to wake a lot of people up. I think it's going to wake up people who have penises, and I think it's going to wake up people who like people who have penises.
ED will affect almost every penis owner at some point in their lifetime. And while medications can be effective, it should be empowering to know that ED symptoms can be reduced or even eradicated by altering one's lifestyle.